Hi, I'm Brian Betts. I'm in the Doctorate in Athletic Training program at Indiana State University. I'm a certified athletic trainer, licensed athletic trainer, and strength and conditioning specialist. Today I'm going to talk a little bit about different manual therapy techniques and trigger points and releasing taut muscle bands and comparing the two. Specifically, I'm going to be looking at um, pressure release and active release technique. So, starting off, the goals of pressure release and active release technique are very much similar. They're to improve range of motion and decrease muscle tension and pain associated with that in active release technique. And active release technique is also to get back to participation or activity, work, school, sport, or earlier and faster than you would without it. The theory behind each of these: in the pressure release, there is a nodule that will form, and it's usually caused because there's a pain spasm cycle that kind of occurs. Oxygen is depleted to the area for whatever reason, and the reducing of oxygen uh, decreases the ATP that can be created through the mitochondria. The reduction of ATP creation causes calcium levels to increase, and then it sustains the contraction because the calcium cannot bind to allow the myosin and actin to disengage. And then this constant contraction compresses the blood vessels, um, and then with that, the blood can't get back to the muscles and increases the oxygen deficit and just continues the cycle. And this usually initiates because of a sustained or repetitive contractions. It's either isometric or concentric, or even eccentric. Muscle contractions can cause this. And essentially, we're applying pressure to I'll get into the application a little bit later. ART is performed in a taut band. Then the touch from ARTs, so you apply pressure in ART, the touch stimulates mechanoreceptors in the skin and the muscle, depending on how hard you push. Ideally, you should be pushing hard enough to do both, to reduce the H reflex, which causes a reaction that doesn't get processed through the brain. This sustained pressure stimulates type 4 mechanoreceptors, which are pain receptors, and the touch actually helps modulate the pain as opposed to feeling the pain from that taut band. Mechanical stimulation then releases endocannabinoids, I'm not sure if I'm pronouncing that correctly, to inhibit the descending pathway of nociceptors, which by decreasing the nociceptors, you're decreasing pain in the area. So it's kind of similar to gate control theory. How it's applied. The pressure release is you palpate for a trigger point, and then you apply gentle pressure to the trigger point until you can feel some resistance or a barrier, which is why it's called barrier release. You feel some resistance, and you sustain that usually for about 90 seconds until you feel the tension kind of dissipate. You take your hand off, or you release some pressure, and then apply some more pressure until you can feel the muscle relax again. So the pressure, and essentially the pressure on the myofascial trigger point lengthens the sarcomere and breaks up that pain spasm cycle. that occurs. Active release technique. The application in the literature is very vague because it is I believe it's a patented or trademarked technique. So all the literature is very difficult to get very specific details on because you need to take a class in order to perform it, and they don't want to give away the technique without you having to pay the money to learn how to do it. So it's very vague. So I apologize for any problem with that, but essentially it uses tension and compression on a specific tissue level to release the tension in the muscles. To do this, you apply pressure to the taut band, and the patient moves from a shortened position to a lengthened position over a duration of about 5 to 20 seconds, and then they repeat this. So one movement. So if I'm going into starting an elbow extension, and then going into elbow flexion, that contraction, that movement should take 5 to 20 seconds to get through that full range of motion, and then you repeat that for 3 to 5 sets. So I wanted to look specifically at how does manual therapy affect neck pain and compare the two, the barrier release and the active release technique. So the patients in the study that I found, there were 47 patients with neck pain due to posture in the pressure release technique, all of which had myofascial trigger point. In active release technique, there were 24 patients, history of neck pain, and mild disability. For the pressure release technique, kind of like I just stated, the myofascial trigger point was palpated, pressure was slowly increased until resistance was felt, and pressure was maintained until that should be an increase in tension is felt for 3 reps, and they repeated this for 3 reps, and then performed a passive stretch afterwards. Active release technique, there was, in this article, they didn't really explain how they did it. It was in the sternocleidomastoid and the upper traps, and they performed over a span of 3 weeks, performing 2 sessions a week with a 20-minute intervention. Didn't specify details on how they got into it, but I'm going to guess it is similar to the technique that I previously stated. And the significant findings, the intervention group in the pressure release technique significantly improved with the effect size greater than 2.8 within the group, so pre-test to post-test, and range of motion increased significantly with a standard error of 1.4, greater than 1.4, sorry. Excuse me. Active release technique improved pain scores on the visual analog scale, a pressure pain threshold significantly. The effect sizes were not listed, and then improvement in range of motion in all directions of the neck, so flexion, extension, lateral bending each way, and lateral and rotation left and right, all significantly improved over the control group. So essentially, both active release technique and barrier release technique are effective means of reducing pain and getting rid of tension in the muscle tissue while also improving range of motion. Active release technique can also be used on scar tissue, while barrier release technique is strictly on trigger points. Active release technique can also be used on an entire muscle that might be experiencing some tension or some contraction or guarding to help break up more of the whole elongated muscle. So here's a list of my references. Thank you for watching. Hope you got something out of this, and I look forward to talking to you again.